Yeah, I think that's...
And sorry,
Yeah,
and
no?
sorry, and sex addiction is actually, it's not the best addiction to have, and actually, it's one of the worst addictions to have because of all the shame.
Yeah.
You know, substance addicts can still hold their heads up high and they can go to NA or AA, Alcoholics Anonymous and whatever, and it's acceptable and, shame, you know, we'll give you time off from work and everything. But sex addiction, first of all, is ridiculed, it's not understood, it's not believed, and the shame causes people to commit suicide. It is so degrading, and they just live a life of absolute revulsion and self-loathing. And that is just, it's one of the worst possible things to have on a regular basis.
Just wanted to welcome everyone to the Remed-e podcast. This is episode 2. I'm your host, Ricky Ormsby. And what the Remed-e podcast is basically a place where we open up conversations around men's healthcare, sexual health, and confidence. So today I'm joined with someone who I am super, super excited about. It's Sharon Rosen. She's a social worker who specializes in many, many types of addictions, specifically sex addiction. And yeah, I'm just super, super excited to get into a conversation that I think a lot of men might not feel comfortable speaking about, but I think should begin feeling a lot more comfortable speaking about. So welcome. Thank you for coming.
Thanks very much.
Awesome. So I think firstly, I wanted to get into how you got to where you are now and how you found that passion to not only work specifically in the space of addiction, but sex addiction as well.
Okay, so addiction, I was quite abusive when I was younger of different drugs, predominantly over-the-counter and prescription. And then I like the whole addiction field. And then sex addiction, I got interested in about 15 years ago. And, you know, codependency is at the root of all addiction. And codependency, I was very, very codependent. And the sex addiction, I really, I can identify with people, because of the shame aspect. Because I've just traveled a long journey with shame. And it's really, for me, that's the most important thing. Because sex addiction, it's the underlying aspect of it is almost always the individual really, really, really handles shame in a terribly dysfunctional way, and I can always just identify with it. So I just love working in that.
Okay, awesome. And I think something that I'd love to touch on is I'd love you to explain to everyone what addiction actually is and what it looks like, because I mean I've personally battled with my own various forms of addiction, and I think one of the things that definitely stood out to me was the fact that I didn't think I had any problem at all because I wasn't at that like extreme level. So I think for me, I was like, I'm not selling my television to buy a bottle of booze. So like, I'm fine. Like I wake up every day, I work, I thought I was being quite a good human being, but turns out maybe I wasn't. But the point is, like, as soon as that topic of addiction came up, like immediately it was a case of like,
Not
like
me.
no, like I refuse. Like I'm not that bad. Like I wake up every day. Like I do my things. I never like not arrive at work, you know. And I think many men, and I mean we'll touch on why many of our patients within Remed-e, I have the feeling battle with this too, but I just think that many men feel like if they aren't at that extreme, and I mean, maybe not just men, I think everyone, if they aren't and that like at that extreme where you see someone on the side of the road, they're like, well, I think I kind of have a handle on it, but that's actually not the truth. And I'd love you to explain to everyone like maybe the forms of addiction and how you see like use, abuse, and all of those kinds of things. So if you could explain that'd be great.
And this is really Addiction 101. I think it's really
Yeah.
necessary for most people for everybody to understand.
Yes.
So use, we all know what use is. You go to a dinner party and you have 1 or 2 glasses of wine and you enjoy it. Or you go to a party and you schnaff a bit of cocaine or whatever, and you don't do it the rest of the time. Okay. Abuse is when you go balls to the wall. That night you go to a party and you come home completely drunk and you've really had too much, or you've schnaffed up a hell of a lot and you can't function at work the next day, whatever. Okay. Also, to bring in the sex part, use for sex addiction, let's look at pornography addiction, would be somebody using pornography, their partner is away, so they use pornography just to masturbate quicker or something like that. Abuse is their partner is away, so the 24/7 while they're away, they're doing as much as possible. Yeah. Okay, so you've got the concept of use and abuse. Dependency is when the body develops a physiological dependency on the mind-altering substance or behavior. And this is where people need to understand that behavior can be an addiction, and behavior like food, a food disorder, or sex disorder or addiction. Okay, so they both, those behaviors and gambling, they all affect the brain in exactly the same way as substances, mood-altering substances affect the brain. You get high and your brain is wired. They've actually done graphic images of the brain of somebody who is a cocaine addict and somebody who is a porn addict, and their brains look identical. Okay, yeah. So, and it just depends whichever one it is that you develop a dependency or an addiction to. Yeah. Okay, so to come back to dependency. So dependency is a physiological, you develop a tolerance to the behavior or the substance, and your body needs more and more and more of whatever it is in order to get the same satisfaction or the same benefit out of using. And then if you stop using that behavior or the substance, you go into withdrawals. So it's a physiological thing. Addiction is a whole psychological lifestyle that gets added onto that physiological dependency. So addiction is, there's like a couple of things that have to be in place in order to go from abuse to dependency to addiction, because some people can get dependent, but they don't actually become addicted. So they would get, for instance, a housewife who is dependent on her sleeping tablets, and she goes to the doctor and says, won't you give me a prescription for more because I need more? And he says, no, you've developed a dependency, you need to stop. And so she goes through a couple of nights of withdrawal, not sleeping, and then she carries on. That's just dependency. An addict will then start going script shopping, doctor shopping, because they now need their drugs. Okay. So with what makes it that some people can stop at abuse and dependency and some people go into the whole addiction is that usually there's some kind of a genetic predisposition. So parents, grandparents, uncles, aunts, cousins, people have got that genetic predisposition. Because there's the genetic predisposition, they live in a household where they learn their coping mechanisms are learned from addicts. And addicts learn not to feel. Feelings of sad, of bad, even of happy, of glad, of rather not feel it because it's too difficult to feel it in, so you act it out. And you act it out by numbing yourself with a substance, a behavior, or something like that. So they learn that early on in life. Again, because they're brought up by addicts or just because it's normally the household that they live in, there's a lot of chaos. So there can be many, many schools that they've attended. There can be lots of people in and out of their their growing up home. And so they've got all of those kind of factors as well that they have to deal with. And generally, addicts, I find, have got a bit of a more sensitive kind of skin, so they don't actually deal with hectic stuff as well as somebody else. So they've got all these things as a predisposition to then developing the addiction that follows just the dependency. And then it's this whole lifestyle. They develop all these defense mechanisms. So there's lying, there's rationalizing, there's reasons why I take it and why I can stop tomorrow if I really wanted to. And it then becomes it grips the individual and it controls the individual. The individual can no longer control it. So the very simple answer to that is somebody who abuses can club their substance completely, but if they know that they have to stop at like 3 o'clock in the morning, they will stop at 3 o'clock in the morning because they still have got control. But the addict has lost control a long time before. The saying is 1 is too many and 1,000 is never enough.
Yeah.
And that's exactly what addiction is.
Okay, that's helps a lot. And I think one of the things I'd love to just touch on a little bit more is, where do you feel, so with understanding what you've just said, where do you feel like the line is, and maybe the line isn't as clear as this, but where do you feel like I jawl every now and again with my mates and we have a good time, and then like I now have a problem? Like, I would assume it's not as clear as like one line, but but I think maybe that's not the greatest choice of words.
I didn't even get
but like, can you maybe try and like verbalize where you think one could maybe turn around and go, like maybe I'm jawling like a little bit too much,
So actually, the answer to that is sometimes you don't know, and you can only know after the fact. So I will see a lot of people that come into my practice and they'll say, I'm an addict. And I'll say, okay, well, let's see.
Okay.
And they say, all right, I want to practice social drinking. And I'll say, okay, well, let's see if you're capable of that. If you're an addict, you're not going to be able to social drink. But if you're just an abuser, then you will be able to. You're just going to get a little bit more mindful and aware of your behavior and stop it so that it affects your health, but just drink socially, and they are able to. But addicts are not able to. So it's about going through the journey with them. A lot of the time with kids, when they're at varsity, they're jawling and everything. The kids that can't stop when they get married and they have children, those are the ones who are addicts. But you only really realize after the fact. But then the people who have got the genetic predisposition and the social learning predisposition and all of that, they need to know that chances are that they, even though they're abusing along with their friends, that they've got a much higher risk of being an addict. But the actual behavior, especially when kids are much younger, is really the same. But somebody who's genetically programmed to be an addict and they take up something that is a very addictive drug, for instance, heroin or crack, or they're playing Russian roulette because they can take the drugs once or twice and already they just want it more and more and more. So I've had people, so specifically with my porn addicts or sex addicts, and we look at porn, most guys do porn when they're young and they're developing, they get into puberty and they're searching for more and everything, and they'll look at porn every now and again. But my porn addicts, you hear them say, I couldn't wait to get home after school, and I would watch, and it would be very secretive, and they would be thinking about it all the time. It would be different to the guys that just use porn. There's always a difference. People who are alcoholics and they first sip, sometimes they say, I had the first sip and I just knew. Others say, I drank and it was disgusting, but I loved the feeling, so I forced myself. And it's The biggest difference between an abuser and somebody who is an addict is the relationship that they have with the behavior or the substance. It's a dysfunctional relationship because it controls you. You are thinking about it all the time. Your life is really controlled by it. Somebody who can have it or leave it, that's a healthy relationship.
Yeah. I think something that I've been thinking about quite a lot lately, especially within Remed-e, because obviously what Remed-e do, for those who don't know, is currently at the moment we help men in South Africa get prescription medication to their door in the most discreet and non-judgmental way possible. Currently, we work in erectile dysfunction, premature ejaculation, and hair loss. And one of the topics that comes up quite a lot with regards to the erectile dysfunction is this discussion around sex addiction and porn addiction. Now, we'll touch on the porn addiction side now, but there's many men that I can have a conversation with that will turn around and be like, what do you mean I'm addicted to sex? Like, sex is amazing. Like, I want to have as much sex as I can, So I think a lot of people look at sex addiction as this like ridiculous, like made up, like.
Well, if I can have an addiction, that's the one that I want.
Well, yeah, yes, yeah. Can you explain as to what sex addiction actually is?
Okay, so first and foremost, sex addiction is not about sex. Sex addiction is an intimacy disorder.
Okay.
The person is longing for intimacy, the idea of intimacy. And because they've got such a wrong idea of what intimacy is, that search for intimacy is just never ending. Okay, so that's the first thing to understand about sex addiction. Second thing is that sex addiction, it's called a process addiction as opposed to a substance addiction because it develops very early on. It can develop at the age of 3 or 4 to 11 usually are the times when it develops, as opposed to substance addiction, which develops usually from about 12 onwards. Okay. It is used as a self-soothing behavior. So it's about, actually all addiction is about self-medication. But when we're looking at sex addiction, it's about that self-soothing where they are trying to take away those feelings that I said before, that instead of feeling in, they act out. So they're looking for something, and it can be pornography, it can be rubbing their genitals, it can be fantasizing about the sex worker that they're going to see. It's about leaving reality and going into this world of where it feels self-soothing. That's what it's about. It's not about actually sex.
Okay.
Most people, for instance, a sex addict who is into sex workers, the actual sex is maybe like a minute long and then it's finished and then they feel disgraceful and regretful and dirty and everything. But it's the build-up, that whole fantasy of intimacy that's going to happen, that's what they're after. And because while they're in that build-up, they're in fantasy land and they've escaped from all their feelings of reality. Yeah. So somebody who abuses sex or abuses pornography is looking for excitement. Somebody who is a sex addict is looking for self-medication. Okay, and that's the most important thing to look at. Also, sex addicts almost always develop their blueprint, their sexual blueprint when they're very young. It doesn't have to be a sexual trauma. It can be. They can be raped, molested, fiddled with. They can have seen some sexual material that was not easily processed and becomes a trauma, or it can just be a negative association. For example, a little kid feeling anxiety and then going up and down the fireman's pole and feeling this wonderful warmth in his genitals and associating that with the anxiety. And then the next time he feels anxious, he'll go up and down the pole to not feel anxious. And then the next time he feels sad, he'll go up and down the pole. And so it gets generalized into different feelings and different behaviors. And then it just continues. So it can be from like a very simple kind of thing to being raped and then continuously processing it and playing it out. Okay. But it's always about seeking that numbing from reality that becomes just too hard. Now I've forgotten what you asked me. But I was going there with the porn.
Yeah, no, we were talking about what sex addiction is, what porn addiction is.
Yeah. Well, okay. And about sex being, if I had an addiction, it would be sex addiction.
Yes.
How it's just not understood. And so, okay, so we've got these people who are incredibly vulnerable, who are all genetically programmed to become addicts, and then they develop this sexual blueprint, and that becomes their drug of choice.
Yeah.
They either go into pornography and or masturbation and or looking at sex workers and being with sex workers, or exhibitionism or whatever. They can do all of that, or they can just do one of that. So we can even have sex addicts who have never, ever had sex. They've only ever masturbated. But they are consumed with something sexual because it makes them feel better for that moment in time. And they're looking for this intimacy that they know, they've got some kind of idea that it would be nice to have it, but every time they build themselves up, I'm going to get it, and then it just disappears. It doesn't ever happen. So it's a continual search. So sex addicts almost always can't have proper relationships with their partners because they're incapable of having that intimacy. So often you've got a sex addict who's married or partnered with somebody else who's also unable to have intimacy, and so they can do this dance away from intimacy and each get on in their own lives with other kinds of behaviors so that they can avoid intimacy with each other and then look for intimacy in other ways. So when sex addicts go into treatment, it's really important to work with their partners as well, because it affects both people or whoever else is in the partnership.
Okay. Yeah, I think that's...
And sex addiction is actually, it's not the best addiction to have, and actually it's one of the worst addictions to have because of all the shame.
Yeah.
You know, substance addicts can still hold their heads up high and they can go to NA or AA, Alcoholics Anonymous and whatever, and it's acceptable and, shame, we'll give you time off from work and everything. But sex addiction, first of all, is ridiculed. It's not understood. It's not believed. And the shame causes people to commit suicide. It is so degrading, and they just live a life of absolute revulsion and self-loathing. And that is just, it's one of the worst possible things to have on a regular basis.
Yeah, I think that's definitely opened my eyes a bit because, I think just hearing that a sex addiction isn't actually about the sex, changes the way you see it completely. I think a lot of people, including myself, might have seen sex addiction as this kind of process of just keep it in your pants and you'll be fine, but understanding that it's not actually about the sex, and this person, this addict, possibly feels like so alone that they crave this intimacy, and that sounds like something that must be absolutely heart-wrenching to constantly try and deal with.
Yeah, it takes people down to their knees. They lose everything, but addiction, people do lose everything.
Yeah. one of the things I'd love to start moving into now is the idea around pornography and where you kind of see the good, the bad, the ugly. And the reason I talk about it like that is because I've done quite a bit of research into porn addiction, and a lot of the research I've read is, you know, more around like the dopamine release and that it's like it's so easy to access it nowadays that why would you go out and try and be with someone and make an effort and flirt if you know that, like, well, if you go out and like you don't come right or something doesn't go your way, well, you can just go home, pick up your phone and have a great time, you know. And I think, you know, like my thoughts on it, and I mean, this isn't coming from the most educated kind of place, but, you know, I think the fact that pornography is so accessible, especially to kids and to children, I think is becoming a huge problem, you know. I think, and that's obviously my opinion. I mean, I know that when I was young, you know, back in my day, I was, you know, like, just for you to get like a nudie magazine was like a process. Like your friend had to steal it from his father's drawer that he was like it was this like,
and nipples had stars.
yeah, you know, like it was this whole thing. Whereas like now, I mean, like it's like you can block it on your child's phone. He'll find a way to unblock his phone. Like it's just so easy, and I think it creates this, like, what I believe, this extremely false idea of what sex with your partner actually is and what it's like. But I'd love to hear what your thoughts are, because a lot of people will see porn as like it is 100% a bad thing, no go, whereas other people might be like, well, maybe there is a place. Like, where do you see that, and where do you maybe feel like, again, there's that like line in the sand that's drawn from when you're kind of using it maybe not abusively, and then where it's becoming a problem?
So again, it's like alcohol. Is alcohol a bad thing? No.
Okay,
Alcohol can be
fair.
very nice for some people, and for some people it's very bad. So pornography is there. It's the relationship that people have with the substance or the behavior. So there's nothing actually wrong with pornography. It's the way that you use it. It's about your attitude that you have when you use it. It's about whether you're using it with balance. Like, if you are only capable of having sex with pornography, then you're probably quite imbalanced, and it's not a very good relationship, because you're having it to the exclusion of real live sex. Yeah. And unfortunately, that's what happens a lot of the time, is that kids get addicted to sex on pornography, and then they're unable to go and have sex because of anxiety, because of the mechanics, because of whatever. The fantasies are not there with a real live person, and it has problems with your interaction and your personality and your just social ways. When I said before that almost always addiction has got a genetic component, it's different with pornography. This is really my own personal opinion, and it's what I've found in my practice. Because pornography is so accessible and you're getting that hit of dopamine all the time, it becomes addictive, even if you don't have all that genetic predisposition. So I work with people who are porn addicts but don't have the genetic predisposition, and I will work with them in the exact same way as an addict with all the genetic predisposition. But the difference is that the one who doesn't have the predisposition goes into recovery a little bit easier. He doesn't have to, he can fall back onto like good coping resources. But the treatment is almost identical. But somebody who develops a porn addiction, they say that it's about 7-8 months that you have to be completely clean of pornography until you can start being sexually functional again. Because what happens is, first of all, you get used to coming to an orgasm just from your hand or from whatever method you're using in order to masturbate.
Yeah.
And so if you're having sex through another manner of whatever, it doesn't work. So there's that aspect. Porn, you get bigger and better, and there's the hype all the time.
Yeah.
So by the time that you are getting aroused and climaxing from what you're getting up here, and now you're just having regular sex with just a regular person that you're seeing every day, it's just so boring and you don't actually get aroused. So that's the second biggest problem with doing too much porn. But if you do porn, just you do it together with your partner and it arouses both of you, or you do it when your partner's away, or you just really want to go to sleep and you all frustrated and you need like a bit of a release, you can do a bit of porn. That's using pornography in a healthy way. And I don't think that there's anything really bad with that. However, you do need to hold it in the back of your head all the time where pornography comes from. If it's with underage people, if it's with women who have been trafficked, if it's, it's got all of that kind of dirty, bad component to it as well.
Sure.
And that's the education that we need to give to our children when they are going to watch pornography. And I say when, because exactly like what 100%. You said, you can't keep them clean from pornography. They will come up to, they will get to it however.
Yeah.
I've seen school kids who have done pornography, they got onto it because they were doing school projects looking at frogs mating, and then it takes them to, and there's Disney sex, and there's it's there. So it's about educating about what is wrong with pornography, what is right with pornography, and how to use it in a functional way.
Okay.
And then for those who find that they get drawn in and it becomes a little bit like a spider's web for them, to be aware of that, and if possible, stop it and try and find other ways if they're aware of being pulled into it. But unfortunately, you often don't get that awareness. You just get pulled in and then it's too late.
Yeah. How would you keep someone accountable to not watching pornography? Because obviously if someone's a drug addict, you can drug test, if someone has been drinking, you can do a breathalyzer. But and I mean, just speaking from your experience, obviously, because you have conversations and have these patients all the time, when someone is trying to quit pornography, obviously not going into too much detail, because I know that these are like months, like years long processes, but how would that process even begin, like when it's so accessible, like
so
it's just so easy?
Again, that is the reason why sex addiction is not one of the nicest addictions.
Yes.
Because wherever you go, there are billboards, there are just adverts all the time that will trigger somebody who has got a sex addiction. It is so difficult to just put your head down. And I mean, just you walking and you see women or men or whatever turns you on just in the streets, it is terribly difficult. So there's generally the 5-minute rule, the 4-second rule, where you look up and then you try and look down again, and you try not to get lost in whatever eye candy you're looking at. There's that. The most important one really is about the various filters that you can put on your phones, your computers, etc. They're not foolproof. People find ways around them, and there's various kinds to try and keep you accountable. Once again, that's one of the reasons why I try and work with a partner, because some of the filters you have to have your accountability partner.
Yeah.
And to try and get them to know if you have logged onto something, or they get details, or whatever, however the filter works. There's that. Some people go back to using the old phones that don't have, they're not smartphones, not WhatsApps, because people are sending in groups WhatsApp material that is very, very, very triggering for sex addicts. And it's really just, you can't really test. You don't know if somebody has used or not. It's about just trying to be as accountable as possible. Yeah. And then in the bedroom, between the couple, they'll be able to see if sex is happening or if it's not happening. And so then they have a bit of an idea that maybe something else is going on the side. And then to be in therapy and try and be as honest as possible with your therapist to work with that.
Okay. Yeah, I think that goes into one of the next things I wanted to chat to you about, which was communication with your partner. Now, we can chat about that from two sides. From the one side of how to communicate the fact that you have a problem, you have an addiction, and you'd like their support in trying to handle it, because I think, and I know that there would obviously be a huge amount of like embarrassment, shame, and I'm not talking specifically around sex addiction, I'm talking about any addiction. And then we can chat about like communication in the bedroom, which is something that's surprising. Well, I wouldn't say surprisingly, we deal with quite a lot in Remed-e, where when our doctor has the virtual consult with the patient, quite often, and this is obviously for the erectile dysfunction medication, the patient will turn around and they'll have the consult and they'll talk about how like they've used these kinds of medications in the past, and like quite often our doctor will get asked questions like, do you have any tips on like what I can do to like try and like spice things up in the bedroom, and our like it's not really a conversation that you have with your doctor, but obviously like these people that are battling with erectile dysfunction, quite often they're trying to prioritize their life in the bedroom a bit more, like, and that's usually why they're reaching out to us, right? And so I think firstly, how do you feel with regards to addiction? What do you feel about communicating with your partner? How does one kind of bring it up or have that conversation without feeling that like embarrassment, shame, and all those emotions that just aren't very nice, Or is that even possible?
Well, I think the most important thing for addicts to understand is that they are not bad. They are sad. They're not bad. They do bad behavior, but they are not bad.
Yeah.
And that, just like, you going for cancer treatment, or you go for cancer checkups, or you can talk about other kinds of legitimate medical conditions, it should be seen in a similar kind of way, because it's not your fault that you're an addict. Especially if it's something that you want to investigate a little bit more, and there should be that openness. But unfortunately, it usually isn't. And I mean, I can try and preach it as much as possible, but it's not. But you go to addiction specialists, and you say, I would like to just investigate to see if I have a problem.
Yeah.
And I say addiction specialist because if you go to just a generic therapist, they often can't make that call, whether it is or whether it isn't. Again, often, if there's a religious component, any kind of other sexual behavior that shouldn't just be in the bedroom is seen as bad, and is not necessarily so. So normal kinds of behaviors could be seen as sinful or bad, and it can hold up the whole recovery process. But ideally, there should be some kind of a discussion between the partners saying, I'm not feeling like everything is okay. I'd like to go and investigate whatever. It can come from something like an erectile problem.
Yeah.
Sex addicts can have a lot of erection problems, because they are using the sexual material in the incorrect way. They can only, as I said before, they get maybe addicted to pornography, and they can't get an erection just from seeing their partner any longer. It doesn't happen, or it doesn't last that long. Or if they're taking any kind of substances, it also affects the erection. And so, it can be erectile problems can come from legit medical problems, heart disease, or it can be depression, or it can be from using substances that they shouldn't be using, or acting out sexually. There's so many, many, many reasons for erectile problems, and it should be all just seen as, like normal kind of, let's go look at what we've got to investigate. Yeah. Why am I getting a headache? Why is my toe sore? Why do I have erectile problems? It should all be on the same level, but unfortunately it isn't, because sex there's a big hype around that. But I think we're much more educated now than we ever were. Yeah. Yeah, there is still a lot of shame and stigma attached, unfortunately.
Yeah, I agree. There's one thing you mentioned there that I'd love to just dig a little deeper on. So you mentioned that if you're an addict, it's not your fault. And how would you respond to someone? So what would be your response in terms of someone turning around and saying, no, it is their fault, it's a choice. So you weren't supposed to drink, you chose to drink, that is your fault. Okay. How would you respond?
So there's a difference there.
I think it's really, really interesting that, because for a long time, I didn't really understand, I was like, well, if you get addicted to drugs and you can't pull yourself right, it's your fault, but as I've started to learn a lot more about it, I've just realized that it's just, as much as it's easier for the brain to understand it that way, it's just not that way. It's just not like that,
So this is the whole disease concept.
Yeah.
There's people who say it's not a disease because then you don't take any accountability for it. And then people who say that if you have a disease, it's not your fault. But it's not black and white. It's a disease. It's not your fault that you have the disease. However, you do have choice in going into recovery. But you have to keep you have to realize that one of the biggest defense mechanisms that is used by addicts is denial. And when you're in effective denial, you don't realize that you've got a problem, so you don't do anything about it. So the way that I try and explain it to people is that it's not your fault. You're not 100% accountable for everything that you do when you're in active addiction. Once you go into treatment and once you learn a bit about it, then you choose to relapse or not, because relapse doesn't happen just spontaneously.
Yeah.
It's a choice. But before you understand that you are an addict, and before you've given the choice to clean your act up, you are not acting 100% without accountability or with accountability. You're still, you should be told don't do that, and then you try not to do it, and you do it, but you're not 100% responsible for your behavior, as a non-addict would be, as an abuser would be. Because there are those levels of denial. There is that disease where I said it's got you. It is controlling you.
Yeah.
But once you go into treatment, and once you understand the choices that you have, and the various coping mechanisms and tools that are at your disposal to use, then you choose whether to act out badly or not. And then you're 100% accountable.
Yeah. Okay. Yeah. That's super interesting. What do you think around, so one of the things that we deal with a lot in Remed-e is performance anxiety, so men that either cannot get erections purely based on the anxiety of I'm not going to be able to perform, I'm not going to be able to pleasure my partner, and then that goes the other way as well, where they have so much anxiety that they can get an erection, but then premature ejaculation is a huge problem. So I think not necessarily the treatment of that, but how do you feel one should speak to their partner about that?
I think it's a little bit like your previous question. Ideally, one should be able to be open and honest about it, because there shouldn't be any shame about that.
Yeah.
But there is so much shame about it.
Yeah.
There can be performance anxiety before you go and do a talk or write an exam, but there's no shame attached. But there is so much shame attached to performance anxiety around sex.
Yeah.
And there shouldn't be, because it's no different.
Yeah.
It's just a psychological thing that you've got to just work through.
Yeah.
But more importantly, it's the partner's way of dealing with it that's going to help the person who's having the performance problem.
Yeah.
If it's just seen as, this kind of shit happens, get over it, it's okay.
Yeah.
If it's as, you're the problem, what's wrong with you, why can't you perform, then it just exacerbates the problem anyway.
Yeah.
Performance anxiety is more in the head than anywhere else.
100%.
And if you start victimizing that person or making them feel that they are not enough, which is already what they're feeling, if you just exacerbate that, then you just got a huge big problem. So the partner has got it in their hands actually to make or break it. More importantly than tablets or any kind of medication or therapy or whatever.
So I think the last thing I wanted to touch on was a little bit of an actionable step for those who are listening and watching, that if one wanted to get help, whether it be emotionally, if they feel like they're battling with an addiction, where do you feel the best place is to start? And the reason I ask that specifically is because, I've had a lot of therapy over the course of my life, and there, out of all the therapy I've had, there have been a very, very, very select few of people that I feel comfortable being honest with. And I think the problem is, like, I didn't feel like I was brave enough to turn around and go, like, I feel like I'm not being 100% honest with you. Like, maybe you aren't the right person for me to speak to. I just, like, continued that journey, like, and lied, So where do you feel is maybe the best place for someone to start, number one, and number two, what do you feel is the best way for them to find someone who they feel confident and comfortable speaking to, if that makes sense?
So, specifically around sexual stuff, there's so much. I don't know how to put this in a nice way, but there's a lot of like fake stuff out there.
Yeah, that's the truth.
So I would really go with people who are degreed and have a professional board backing them. I belong to it's a mass sexual health group that is, there are professional physiotherapists, doctors, therapists, psychologists, social workers, people who know and have studied around sexual stuff. So an organization like that is like really got all the professional backing. You would find places like that, I suppose, with Googling and looking at degrees. Some people have got websites saying specialize in this and that, but they actually have got nothing behind their name.
For sure.
Because if you're working with somebody who's just working on their own steam and doesn't have any kind of board that holds them accountable, it's not a very wise place to go and pour your heart out on such a sensitive issue. There can be a lot of damage that's done. I've had to deal with a lot of damage that's done with other people, even actually other professionals, where they've told people who are not sex addicts that they are sex addicts. And the kind of trauma that they've gone through is problematic. Yeah. And I once had a guy who had to go through a whole program. He had affairs in the workplace, but he had to go through a whole program and questionnaires and about, do you like it with little children and like really traumatizing stuff. And if people don't know what they're doing, they really can do an enormous amount of damage around the whole sexual area with sex addiction. Imagine to be labeled a sex addict and you're not a sex addict, and then you go around. It's horrible. So that would be the first thing, is to look at proper professional backing. And then there are places like SADAG, the South African Depression and Anxiety Group, that would maybe have referrals. To ask friends and doctors, psychiatrists refer, but it's hard. It's very, very hard. The people that have come to me, they've generally come the long way. Yeah. And they've been dealing with it for years, and then they find me and they say, thank goodness, eventually. And it's a long treatment process. It can be, 3-4 years. I run groups for men with sex addiction. And I don't know really many other people that do regular groups, because groups are amazing because of that shame aspect. Just start talking and identifying one shame with another person's shame, and it's quite healing in a group aspect. Yeah. There's obviously the SAA, the Sex Addicts Anonymous, and Sex and Love Addiction Anonymous. There's those kind of groups as well. But because sex addiction is one of the newer addictions, some of the groups are not amazing. Yeah. Some of them are good, some of them are not so good. And there's a lot of literature out there now on sex addiction as well, which is also quite helpful.
Okay, great. So for anyone who would like to get in touch with Sharon, I'll put some of your details in the description and the show notes, if that's obviously okay with you, if someone would like to get in touch. But apart from that, I just wanted to say a massive thank you to you for being a part of the show. I think this is delivering a huge amount of value and touching on points that I think need to be spoken about a lot more. So thank you so much for joining us.
Oh, such a pleasure. It's nice to get the message across because, as you said, a lot of people don't know enough about it. So it's a brilliant way of doing it. So thank you.
My pleasure.